Alice Forrester.
Well, I can't follow that lead. But I'm going to go the same passion in terms of neighborhood. I'm going to talk about it as an association. Clifford Beer's Clinic is 101 years old. We've been around a long time. And I'm telling you that the only way we feel we're going to be able to do any of the work that we feel we need to do as an agency is with you. We are doing it, and I prepared a PowerPoint that was the opposite of the passion, but if you could just put it up, because it's complicated, and skip this slide for a second. Okay, Clifford Beers. We want to become a provider of excellence for serving family and children who experience chronic stress. Because guess what? All the kids who come to us with mental health issues, they have chronic stress, they've been exposed to adverse childhood experiences. We want to improve child and family health through integrated care. We want to be in the schools, we want to be in the primary care clinic, we want to be dealing with other mental health agencies. We have to be financially sustainable. My traditional model of outpatient care loses $500,000 a year, and that's in a good year. Everything else I do is trying to keep that alive. Financially, economically, mental health doesn't make, I can't cover my costs in the agency. And we want to be able to influence public policy. So we have the next slide has 4 major collaborative projects that we're working on right now, and I don't have to go to a meeting after this, but I had to go on before. But we've got the Promise Neighborhood, we're trying to participate on this. We have New Haven Trauma Coalition. I was just, all the related school staff, we were just training today around trauma and crisis response in the schools. It's New Haven Public Schools, United Way Booth, City of New Haven. Mom's Partnership is 7 guide team members, New Haven Public Schools, the Housing, Elm City, Yale University, Maria and the Public Health, all my colleagues are in this room. And Project Launch, which just got funded from DCF, which is a Dwight neighborhood activity. And Wraparound New Haven, which is for the whole city, in particular in Fairhaven, looking at a federal initiative to be able to prove that the kind of care that we believe is the right kind of care for our children and families will actually work. And we're doing that in partnership with Yale New Haven Hospital and Fairhaven Community Health Center. Change the next thing. This is a very impossible slide, but these are all the goals that are in each of those 5 different projects I'd be happy to share with you. But they're all about the family. They're all about the family. For us, and for our knowledge of the work that we do in our community, our families are suffering, and our families are suffering from basic needs, from housing, from work, and from stress and acute trauma that they have had before. So if you can kind of go to the last, this is terrible color. I don't know what's going on, but anyway, the family is in the center. What we're trying to do is work with the schools. We have the New Haven Trauma Coalition, which is going out to all the public schools. We've trained over 300 staff in the New Haven Public Schools since the last 2 months on what is trauma and adverse childhood experiences. We want folks to go from what happened or what's wrong with this kid to what's happened to the child. We're working with the community with the physical health folks, and we'll be putting a full-time clinician in Yale Primary Care Clinic, as well as now we have staff in New Haven, in Fairhaven Community Health Center, as well as Martinez School, all funded as subcontractors through Fairhaven. We are really clear in the Moms Partnership. We're building 10 hubs in the New Haven community. I have many of my moms folks are here. We're doing stress management courses for moms in the Elm City housing. We're really looking at trying to get to the family earlier and quicker so that a child doesn't need to be diagnosed with a mental health problem in order to receive services. So no one wants to pay for those things. I mean, maybe if anybody does, raise your hand, but no one in the medical world pays for prevention. Now with the Affordable Care Act, things are changing, and we as a community have this amazing opportunity to be able to go earlier and quicker, well before they are diagnosed with any symptoms or problems. And, I'm sorry, I just really have one last slide. One last one, I promise you. It ain't happening unless, it is so hard. Collaboration is so hard. You need vision, you need leadership, you need long-term planning, You have to have unified data collection, you have to have mutual agreement, and frankly, with Mr. Clemens' point, is you have to assume benevolence with each other. We have to, I am really strongly assuming that he's got my back, I've got his, and we're in this together because our families are together. So that's really what the key soft factor, if you will, is going to happen in this project.
It's a good segue.